Okay. I didn't follow through on that button. Thank you, Jamie. All right, so welcome to Project Firstline's office hours for July. Office hours occur the second Wednesday of every month at 11 o'clock. Feel free to tell your friends and colleagues that they too can join office hours by navigating to our website at www.sdprojectfirstline.org and use the link to register for office hours. You can also use the same process to register to receive our monthly newsletter, which covers a new infection prevention topic every month. Next slide. Oh, you already did. The CDC launched Project Firstline nationally in October of 2020 to address long-standing gaps in infection control knowledge and practice, and to get IP knowledge to frontline healthcare workers during the pandemic. Since then, Project Firstline has evolved to serve all members of healthcare. Aside from hosting office hours, the South Dakota Project Firstline team is busy providing training and education to hospitals, long-term care centers, assisted living facilities, and congregate living facilities. We also provide education and training to nursing, dental, and community health worker students, as well as dental hygienists. We visit local fire and rescue facilities throughout the state, providing training, education, assistance with their ambulances, and their practices. There are currently 64 Project Firstline jurisdictions in the nation. The South Dakota Department of Health has contracted with us, the South Dakota Foundation for Medical Care, to bring you Project Firstline in South Dakota. The team has prepared a fantastic presentation for you today, so let's go ahead and get started. If you have any questions during the presentation, please feel free to come off mute or raise your hand or add them to the chat so we can help answer them. Your interaction and feedback is very valuable to the team. This is a safe place for sharing. Next slide, please. As I covered earlier, that is me in the upper right-hand corner. My name is Rebecca. I am the team lead. I'm gonna give a moment for everyone else on the team to go ahead and introduce themselves.
Hi, I'm Valerie Wagner. I am a Master of Science in Nursing for nursing education, and I also work in home care setting with Bright Start.
I'm Renee Robbins. I'm a registered respiratory therapist and pulmonary function technologist with a bachelor's in health sciences, emphasis in public health, and I work on Project Firstline along with Dementia Dialogues project within SDFMC.
And hi, I'm Jamie Rogenbauer. I've got a master's in public health. I've been an EMT for about 14 years, and I've worked in different public health spaces, including for cardiovascular, diabetes, maternal and fetal health outcomes. So we're excited to be here today. Okay. You want me to take it from here, Rebecca?
I would love to.
Okay. Today's topics, we're going to talk about devices. Germs can live on devices, common devices we're going to see in different healthcare settings and where they're going to live, and then how to reduce the risk of those germs spreading. This is a nice little infographic that the CDC's Project Firstline website provides us. It's something easy to post in your own healthcare spaces. That's just a nice reminder of where germs can live on devices. Okay, so germs live on our devices. These are some common germs that we're going to find in our different healthcare settings. Just to keep aware of, they have different lifespan survival rates. Some of them very short and some of them very long, up to 4 years for things like VRE. So we just want to be aware that germs are created differently and they have different lifespans. So when we do infection control and prevention, we just want to keep in mind our different rates. Okay, so common devices that we are going to use in our healthcare task for things like taking patients' vital signs. So we have blood pressure cuffs, thermometers, pulse oximeters, all things that are going to touch patient skin that we're going to touch, other patients can touch. And so we just want to make sure that we're cleaning in between those things so that we're not transferring germs from one patient to another or to ourselves and bringing those home with us. And then things like transportation devices, lifts, wheelchairs, transfer boards and belts, ambulance cots and stretchers. And so I think about if we're helping a patient sit go from sitting to a standing position, are those belts getting cleaned? We're touching them, they're touching them. Our wheelchairs, people's shoes get dirty, different things get on them. Are we cleaning that? Lifts. So those are all places to think about. And then things we don't think about that often are like scales and our monitors. So every time I go to my doctor and I step on the scale, I always want to know what weight I am. They always do it in kilograms. So I always touch the screen to do my lbs because I want to know. And so patients are touching those, we're touching those. They're just other things to consider where germs can be living. Okay, so where is the risk? So a device, any device like a pulse oximeter, it's used on that patient's body. If we're not cleaning it and disinfecting it in between our patients, it can spread from them to another person or to us, and we can bring that home as well. That's even exacerbated when we're thinking about devices that go inside of patients' bodies. And so not necessarily going from one patient to another, but are we doing proper hand hygiene so that when we touch that device, it's not going into a patient dirty and then causing more harm than we want. Okay, how to reduce this risk? Cleaning and disinfection. So cleaning and disinfection can occur at the same time if we have the proper wipes, but disinfection is never going to occur before cleaning. We can kind of think of the cleaning as the clearing away or even reducing the harmfulness of like germs and viruses, but that disinfection is what's really going to get rid of them. And then our hand hygiene. Hand hygiene is so important. We have our soap and water or alcohol-based product. CDC highly recommends the alcohol-based product. It has to have over 60% alcohol in it for it to be effective. But always be doing proper hand hygiene before we're touching devices, before we're touching our patients, ourselves, and then after as well. And then the use of personal protective equipment, our PPE. So we want to perform good hand hygiene before we do things like put gloves on, because those gloves never come out of the box super easy, right? We're always trying to pull them from like their other gloves that are stuck together. And so if we don't have clean hands and we're pulling those gloves out, then everything, all those other gloves, the box, they're also getting whatever's on our hands during that time. So we want proper hand hygiene before we put on our gloves. Never double glove. And then when we take our gloves off, we want to do that hand hygiene again. And so it's going to look different in different settings. So in a clinical and hospital environment, we're going to have access to both soap and water and our alcohol-based products. But in different environments, like if you're going into a patient's home or if you're meeting them outside of the home in a public place, like our home health settings, they might not have access to running water or soap and water. And so we want to be prepared with that alcohol-based product with that at least 60% alcohol in there. Okay, and then from an EMS perspective, because I'm an EMT, so when we think about devices outside of our hospital and clinic setting, we can think about people's homes, maybe long-term care facilities, on our ambulance, in outside spaces. So there's been plenty of times where I responded to somebody who was in the park, and they're not going to have the same resources that a hospital clinic might have, but they might still have medical devices on them, or we'll be using like pulse oximeters or things like that with that patient in that space. And then there's also things like shelters and group homes. So all of these different environments, they're going to have different devices available. And so we just have to be aware of what germs can be on them and what's going on. Okay, so an ambulance. So I like this picture. All ambulances are created differently, especially our rural and urban ones. They're going to have a lot of different equipment on them. But look at all of the different spaces and places that a germ could live. So we have like our neck collars, we have our different machines that measure our oxygen, our heart rates, EKGs. We have a fan up here. Man, the floor is so dirty. No matter how many times we clean this ambulance floor, don't put anything on it. Our feet are going to be dirty. If we put our bags on it, whatever's on the floor is going to get into our bags. We have our cots, skids and things like that. And so germs can really be everywhere. So we just want to be really cognizant of where things can live. And then a patient's home. So like I said, providing care in and out of the clinic can look really different. Out of the clinic, it's more of an uncontrolled environment. Again, they might not have running water. It could be even like an emergency or something like that. We want to consider those situations. And then the devices that they have, they're probably personal devices, or maybe they're ones that are kind of on that rent. And they're probably not getting as routinely cleaned and maintained as something in a hospital or clinical setting would be. And so we want to be cognizant of those kinds of things. Okay, so different environment, same infection control, risk reduction. We still want to be making sure that we're doing proper hand hygiene, that we're utilizing our PPE to keep ourselves safe, to keep our patients safe, and to keep our other patients safe. And then we want to make sure that we're cleaning and disinfecting our spaces. Okay, so we're going to test our knowledge, and I'll let Rebecca look in the chat for us. So put in the chat, disinfection comes before cleaning, true or false?
Don't be shy, everybody chime in. Now we have some coming in, some answers coming in. I think in general, everybody has answered false.
Awesome. So, yep, it's false. So, cleaning is going to come before disinfection. They can happen at the same time if we have the right hospital grade wipes equipment for it. But think of cleaning as that clearing away or even reducing the harm. And then that disinfection is really eliminating. So, you guys are excellent. We'll pop on to the next. So, one more, or I think there's two more. Medical devices only need cleaning if visibly dirty. What do we think about that? And don't be shy. You can always come off mute.
So far, we have one brave person to answer. Anyone else want to chime in the chat? All right, it looks like false is the answer we're selecting for that as well.
Right. So I wish I had superhuman powers to see all germs and pathogens, but we just don't. We're not able to see them visually with our eyes. So if they have been used or even out of commission for a while, we have to assume that they're dirty. And so we want to clean and disinfect those medical devices. And then last, test your knowledge. I should perform hand hygiene before I put on gloves. What do we think about that?
All right. Several people replied, and it seems true.
That's true. You guys are on fire today. So our hands are dirty. And if we take our gloves out before we perform proper hand hygiene, whatever is on our hands is going to get all over those other gloves and that box or wherever they are. And so we want to make sure that we have clean hands before we put our gloves on. And then when we take them off, we're cleaning our hands again. So you guys did excellent. Okay. Questions or comments for the team? We're going to open it up to you guys.
Again, safe space if you have any questions, even if they are maybe only mildly related to today's topic. Anything in infection prevention in general, we can ask that too.
And we're not going to bite. We can. It's virtual anyway. So. No, well, don't feel nervous to reach out to us. We're happy to answer questions or comments for you guys anytime. It doesn't just have to be for office hours. We have this great QR code that we would really appreciate everybody scanning and filling out. It's a really short questionnaire. It just has 5 questions, I think, on it. But the CDC, that's how they keep track of how we present and who we present to. So we really appreciate if you guys would fill it out. And then we also have this one. So this is our Project Firstline QR code. We don't know if you guys know this, but on our website, we offer free dental and EMS CE credits. So if you're interested in them or you know someone who's interested in them, please check out our website. They're there for you guys to utilize. It also has free infection prevention training, lots of links to the CDC, infographics like the one that you saw at the beginning of the presentation that cover all sorts of different things that are just kind of handy to have around our clinical and hospital spaces. Or even if you're visiting somebody in their home, you can have a little printout of it and take it with you as an infographic for them. But Rebecca, other thoughts?
Yeah, I would say going back to the previous slide with that QR code, Jamie covered on how important that is for us as a team for reporting purposes to the CDC, but also there is a free space on there. So if there's a topic that you would like us to cover, if you've noticed, our team has grown considerably. And with that, we bring all new backgrounds and knowledge with. So we would love to be driven a little bit by topics that are relative to you and that you want questions and answers for, by all means. So that's also an opportunity in that form there to drop any of those ideas for topics for us to cover. And we'd love to do that for you. I think there's a place at the bottom of that, but otherwise, I think the team did a great job today, and we look forward to seeing you all again at the next office hours. And one more opportunity for anyone to ask us any questions. Speak now or forever hold your peace. All right. Well, with that, we'll give you a little bit of time back in your day today. Thank you all for joining us, and we hope to see you again next time.